Alright, Kirk, so I'm just reviewing your medical history. Is there anything else that I should know about?
No.
Great, let's begin. Okay, Kirk, so we're done all of your assessments. Now we're going to go over everything that I found. So just now I was assessing your gums, and I've determined that you do have active periodontitis. Are you aware of what that is?
No, I don't have that. I brush my teeth all the time. What is it?
Kirk, periodontitis is an inflammatory disease that results in some extent of permanent damage to the tissues of the periodontium, including loss of your gingiva, which is the gums right here and there, your alveolar bone, as you can see here, that one is much higher than that side, and your periodontal ligament, which is right here.
I didn't even realize that that was happening. What can I do to make sure that it doesn't get any worse?
Well, Kirk, in order for you to understand fully, I need to make you aware of what caused this. Your past history of smoking, your moderate plaque buildup, which may be caused by your dry mouth. Your dry mouth may be caused by some of the medications that you may be taking. All these factors are included in your active periodontitis.
I didn't realize that it was that serious. Can you give me some strategies to help make it better?
There are a few things that both you and I can do. I'll be giving you a cleaning which removes most plaque and cuteness from your mouth. I will also be introducing you to some new techniques such as flossing and brushing properly, which will improve your oral self-care.
I'm not going to floss. I don't like flossing at all. It's so frustrating, and I just don't want to do it.
Well, we can introduce you to some new things. There's these things right here called floss picks that should make flossing much easier for you. Great job, Kirk. Good modified Stillman technique. So, along with your period disease, we do need to go over your caries risk assessment. I've determined that you are at risk for cavities. The pain you're experiencing may be due to a cavity. The dentist, though, will need to make an appointment with you so he can assess this.
What do you mean I'm an extreme risk?
You're at extreme risk due to the amount of plaque in your at-home oral health habits. Hopefully, with some of the modifications that we made today, this will improve your oral health and remove some of the plaque that you have. As we discussed before, Kirk, the meds you're taking are causing dry mouth. The medical term for this is xerostomia. Saliva is great for hydrating the mouth and washing the teeth. Unfortunately, you are not producing enough saliva, which is causing dry mouth, which is putting you at extreme risk for caries.
So what's the plan to help improve my condition?
I'm going to recommend some things for you, Kirk. First thing is fluoridated toothpaste. The fluoride in this will decrease your risk for caries and also help with your saliva production. I am also going to recommend fluoridated treatment in the office. We'll be doing this at some of your appointments. The percentage of fluoride is higher in this, so it will help with your caries risk.
What do you recommend that I use for my dry mouth?
Well, you can go to your local drugstore and pick up a dry mouth rinse. This will also help with decreasing your caries risk. Questions or concerns for me at the moment?
Well, I was looking at my teeth the other day and I noticed that I had some stains on them, and I think it's from my previous smoking history. Is there anything that you can do about getting rid of them for me?
Yes, of course. We can provide a selective polish at some of your appointments. The polishing will remove any stains from your past tobacco use. So how do you feel about the goals? Do you feel like they're achievable?
I feel really confident about them. I feel like you've taught me enough today as to why it's important that I follow through with them, so I feel like I should be able to do it.
Great. So on a scale of 1 to 10, how confident do you feel like you can achieve them?
A 9.
A 9? Good. So I'm going to go through the appointment plan with you. You can let me know how you feel about this as you go on. Alright, Kirk, so at your next appointment, we will be starting our cleanings. We'll be doing the cleanings on all of your bottom teeth. At that appointment, we will also be following up on your oral hygiene instructions to make sure that your goals are on the way. The next appointment will be another cleaning, but that will be on the top part of your teeth. So all surfaces there. We will also be doing a selective polish, which will remove some of the stains that you have from previous smoking habits. And we will also be doing a fluoride treatment, as we discussed before, that will help with preventing caries. And then after all of that, we'll be assessing your tissue just to evaluate the healing process and make sure you're on track for everything. right, Kirk. Do you understand and consent to all of your treatments?
Yep.
Perfect. So I'm gonna get Dr. Greco for you, and he's gonna assess the 1-7 that's bugging you. Okay?
Okay.